how common fungal infections are in India today. We have with us Dr. M. Natarajan, the Senior Consultant Physician and Professor of Clinical Medicine from the MADURAI Medical College. Welcome, Doctor, and it's so good to have you here at MACLEODS Medlive at Apicon 2019. So we'll start off from right there. How common is fungal infection in India today?
Okay, thank you for the opportunity. Now, we divide fungal infection into gross, superficial and deep fungal infection. And superficial fungal infections are very common right from the beginning of even the last century, and that is managed by dermatologists. But deep fungal infections, which affects the internal organs, are very uncommon probably till 10-15 years before. Now that has also become reasonably common for reasons which I will tell you in the due course. So they are now quite common nowadays.
Okay, so I think we can come to a conclusion that fungal infection is spreading like an epidemic today. And what exactly are the reasons for the fungal infection?
That is the exact thing which I wanted to tell. That is why fungal infections are now emerging as a very important epidemic cause. The first reason is we divide people into immunocompromised individual and immunocompetent individual. Now, fungal infections are quite common in immunocompromised. So, the following are the people who are immunocompromised. Number one will be diabetes. You know, diabetes, India is the diabetes capital of the world. So, that is the first cause for fungal infection. Second will be HIV, and India has harboring many cases of HIV. So, they are also immunocompromised. And third will be your cancer patients. They are also immunocompromised. And fourth will be the chemotherapy for cancer. They are also prone for fungal infection. Now, we have got very many rheumatological diseases for which we treat with biological agents, and that is an important cause for this fungal infection. And even now, immunocompetent individuals also develop this fungal infection when they go for exotic tourisms from caves. So, these are now the few causes why that sudden and epidemic of fungal infection.
Okay, well, so I think as far as fungal infection is concerned, there are so many over-the-counter drugs that are available, and people do resort to taking such medications. How far would you recommend it, and what are the disadvantages of using these drugs?
So, I strongly condemn this over-the-counter prescription, though that can be given for some as painkillers or antihistamines, but not for fungal infection, because very difficult to diagnose fungal infection even by a skilled clinician. So, if that be the case, how can you go for over-the-counter prescription? And because over-the-counter prescription, they give a wrong drug or sometimes the right drug at inadequate dosage. So, ultimately, you are going to promote resistance. So, unlike antibacterial, you are having only very few antifungals. If you take over-the-counter and stop short, you are going to develop resistance against that antifungal, and ultimately you will be bankrupt with the antifungal. We will not be having any antifungal at all to act. So, now hardly there are some 4 or 5 antifungals. So, if you use it indiscriminately over the counter, this will they will develop resistance to these drugs, and ultimately we will be not having any drug to treat fungal infection, and we are going to succumb to fungal infection. So, I strongly condemn OTC.
Okay, so well, that has been an eye-opener. Thank you so much, Doctor, for joining us.
Thank you very much. Thank you.